Let's offer staff some autonomy in defining balance. Recognize them as individuals, focus on their psychological safety and their experience, and let's include supporting flexible scheduling and looking at how we can decrease overtime exhaustion. We need to ensure staff are properly trained for the tasks that they need to accomplish, whether it's a different area they need to work in or different tasks they need to do. Staff who have adequate training report less burnout. We need to also prevent violence and abuse as much as possible. And when these behaviors do occur, we need to wrap supports around staff instead of asking staff to go seek help. And we need to provide mental health support that's accessible and meaningful to the staff who need it. We need to look at innovative ways of supporting our teams, and we need to rebuild trust. Our teams need to trust that we actually care about them, and then we need to trust that they actually know what's best for themselves, their teams, and the people they serve. We need to stop telling people to be more resilient, and instead we need to create resilient environments that support people to thrive. Research is clear. Individual level interventions only help when they're a complement to organizational and system approaches. So let's find a way to restore the connection between healthcare teams, their patients, residents, and clients to bring humanity back to healthcare. It's the human connection, the privilege of being with someone when they're at their most vulnerable and bringing them comfort. That's what healthcare is all about. There isn't a lot of time, but we can move together. We can strengthen the sector to support the new generations and to find ways to hold on to the experienced staff that we have. Today is a great place to start. The pandemic upended our lives in so many ways and has caused so much pressure for the healthcare system. Let's take some of that control back and give it back to the sector. Let's continue to recognize mental well-being as incredibly vital to overall health. And then let's invest in ensuring that our teams have the access to the best mental health supports available. And let's celebrate healthcare teams who are doing extraordinary work under the most demanding of circumstances. Let's celebrate healthcare as noble work, the best kind of work, because it's people helping people. This is our story, and we get to write the next chapter. Together, with all the brilliance, compassion, and ingenuity that we have gathered in this room, and all the brilliance, compassion, and ingenuity that we have in the over 300,000 workers who we support in this system. This is our story of how we did the next right thing. We have a chance to do that right thing now. Today is going to be about coming together, sharing our ideas and experiences to develop solutions so that we can rebuild trust through action. By working together, putting our collective energy to work, and moving one stone at a time, and being dexterous and deft, we can move mountains. Thank you.